yes, we all know that there are newer strains. The B117 is highly transmissible. The newer strain in India, 617, B1617, we are still learning about it. I can't say things with that certainty about it, but it's certainly a factor. But our own fatigue, our small gatherings, our large gatherings, the virus loves it. And I think, as I've always said, we are either helping the virus or we are helping ourselves. We can't do both at the same time. So those factors are all playing. 5 days. That's the window for antigen positive tests. So the rapid antigen test is most useful in that window of 1 week. The PCR test is actually much more positive and much more strongly sensitive. It'll be positive 1 or 2 days before you become symptomatic, to up to 2 weeks, perhaps, sometimes longer than that. Some cases up to 50 days. So I have not seen any authority or any clear paper suggesting that this strain will render the test false negative. Why that is happening is very intriguing, and I don't know the exact answer if that's happening in many cases. Sometimes it's also possible there may be other viruses floating around and someone is sick with RSV or influenza or adenovirus, but their symptoms can be very similar. Respect the virus, don't fear it. There is never any reason to panic because you will only do more harm. Here are some quick pointers. 95% of COVID deaths occur in people over the age of 50. So number one. Number two, what increases that death is obesity, diabetes, cancer, dialysis, high blood pressure, and other chronic illnesses or immunosuppressive drugs. If you don't belong to that group, your mortality should be very low. And it should be, in most cases, you should be able to treat yourself at home. If you fall into those risks, somehow figure out the nearest place where you can get a pulse oximetry. That is the thermometer for COVID. Because if your pulse oximetry, and it's a very simple tool, some people can buy it online. I'm sure you can go to any doctor or hospital and you don't have to get admitted. You can very quickly get tested. As long as it's over 94, you don't need oxygen, you don't need remdesivir, you don't need steroids, you don't need anticoagulation. Your regular paracetamol or ibuprofen should work. However, if you belong to those high-risk groups and your pulse ox falls below 94, I think then you should consult with a doctor or a hospital. Asymptomatic? Are they mildly symptomatic? Are they developing a pneumonia? Or are they developing what we call a multi-system inflammatory disorder, which is the scariest? So far, the studies have shown that that last thing I just mentioned, the multi-system inflammatory disorder, is very rare, extremely rare, to the point that I don't think people should be worried about it.
Okay.
Be educated, but we should not be freaking out about it. But if our schools are open, our society is open, the virus is running out of elderly group as vaccination improves and as more and more people get infected, it's unlikely to get reinfected. So the virus is probably finding new targets. But I think there's a lot of research that needs to go into this area. At this stage, I would say our routine precautions should work, and we should not let this virus dominate our minds in a way that... Sure. So the Lancet paper talks of 10 points they make that why this COVID is airborne. Airborne does not mean that our air is contaminated. It only means that it can remain suspended in the air, and it has higher infectivity. So if you go into a room, particularly in indoor settings, it can remain suspended and you're at high risk. Now, coming to our protocols, it was all because of PPE shortage. It was because of the shortage of N95 and their price that we all resorted to surgical masks, or in some cases cloth masks. In an ideal situation, we should have worn an N95 right from the beginning. That's what we do in the hospital, but that was not, life is not ideal, life is practical. So yes, during times of shortage, it was okay to wear a cloth mask. It was okay to wear 3-ply cloth mask. It was okay to wear a designer mask, right? But now, when the numbers are so high, I think you should look for the best protection that's available. If you can, get an N95 mask. If you cannot, get a KN95. If you cannot get that, get a regular surgical mask like this. And yes, if you cannot do that too, then you can go with a cloth mask. I'm just telling you that you should look for the best protection. Indoor settings is where our protocols should change. We should be more careful with indoor settings. That's where this virus, transmits much more faster. But besides that, nothing big has. And we also know the variants. So as the virus ups its game, what's the natural response that we should have? We should up our mask game. That's all. There's nothing more to it. Legitimate questions. That's how reasonable minds work. People should ask questions. There's nothing wrong with that. But once you get your answers, at some stage you need to make a decision.
Yeah.
And I think in this case, vaccination is not just an act of self-interest where you help yourself. It's a compassionate act. It's an act of common good. If somebody's pregnant, by getting vaccinated, they're helping the baby because the antibodies will pass through. If you're a young person, by getting vaccinated, you're helping your grandparents or your parents at home who may be elderly, may have underlying diseases. If you're a healthcare worker, by getting vaccinated, you're helping your patient because you will not transmit it. So I want people to look at it from that angle, not just look at it selfishly. I can bang my car somewhere and have an accident. That has a different consequence. What, God forbid, if I hit into a pedestrian and kill someone with my car? How would I feel then? And I know of cases firsthand where young people did not get vaccinated, took it home, they were fine, someone else at home got COVID, and then they died. I don't think we have a lot of drugs that are effective against COVID. The new monoclonal antibodies, of course, I don't know if they're available in India. There's an availability issue worldwide, but they are helpful in the early diagnosis. Once you early diagnose in the early stages of COVID, they minimize the risk of getting hospitalized for high-risk patients. But as far as remdesivir is concerned, I've used it now in dozens, if not hundreds of patients selectively. And I can tell you it's a marginal drug that has a marginal impact when used early in patients who are high risk, who what we call have hypoxia. That means they need additional oxygen. If you use it other than that, it has no benefit at mortality. It has no benefit at reducing someone's risk of ventilation or even reducing someone's risk of hospitalization. I would call it as a marginal drug. When you're desperate, you use everything. But if tomorrow there were 3 other drugs and they were better than this, nobody would even talk of remdesivir. A home treatment should be no different than the treatment of any other sore throat, cough, fever that you've always had in the past. Whatever worked for you in the past should work this time as well. Your symptoms may be longer duration, you may recover slowly, but there's nothing fancy needed. I cannot emphasize it enough. Just because this is a pandemic and it's a fancy virus, a new name, we don't have to throw vitamins at it. We don't have to throw immune boosters at it. We don't have to unnecessarily take antibiotics. And I say this because I belong to that part of the world. I've spent half of my life in that part of the world. I know how people are competing multiple priorities. The same person has to worry about paying the rent and paying the fee for his children's uniform and whatnot. Don't waste your money on unnecessary stuff that can only harm you, because everything you put in your system is going to have an effect or a side effect. So if you're healthy and if you're home and you're not critically ill, which is going to be 80 to 90% of the people, just do what you always did. Add the layer of protection and isolation. Make sure your goal should be that COVID must die inside your body, because COVID's goal is it has to jump from your body to someone else's body. And that is the fight you should be focused on. If it has gotten to your home, make sure it goes nowhere from there.